all life on this planet either is the microbiome or has a microbiome. When our gut suffers, our total health suffers. I was 50 pounds, 20 kilos overweight. I had high blood pressure, high cholesterol, but it was clearly affecting my mood and my ability to do my job as a medical doctor. So I was depressed, I was anxious, I had extremely low self-esteem. And in that moment, which was my lowest moment, I needed help. And it wasn't until I discovered the power of nutrition that it changed everything.
Dr. Will Bulsiewicz is a board-certified, award-winning gastroenterologist, a New York Times best-selling author of Fiber Fuel. He's the internet's most trusted source on the importance of improving our gut microbiome for our brain and body. But all that kind of stuff has been covered in other podcasts. I wanted to focus on the weird and the marvelous, the stuff I think is far more interesting about the billions of little organisms that live inside each of us. Stuff Dr. Bulsiewicz has never gone into on any other podcast.
I'm smiling right now because I haven't been asked this question, and I love this question.
Yes.
It's a fascinating question. They took identical human twins that were discordant in terms of their body type. They have the exact same genetic code, but one is obese and one is skinny. They took their microbiome and they transferred it into two animals. So the obese microbiome goes to a mouse, and the skinny microbiome goes to a different mouse. They fed these mice the exact same food, the exact same number of calories, and the obese mouse became obese.
Oh my God.
And the skinny mouse was skinny. You got great questions. Thank you, Evan. I really enjoy this. I like that you think this way.
Kind of been branded on the internet as the #1 poo scientist, and I kind of wanted to just get your thoughts on how you feel about that branding and how that kind of aligns with your mission.
I mean, I don't have to be honest with you. This may sound bizarre because I've worked very hard during my career to be where I am, but I have no problem with that at all. And the reason why is because I feel like poop has been misunderstood. And we have stigmatized it. And that is the actual issue. The issue is that we have stigmatized it where we're not supposed to talk about this. We're supposed to feel some sort of shame around it. This is something that happens in private. You're never supposed to, like, unless you talk to your doctor because you have a health issue, there's nothing there that you would open up about. And I actually think that's an inherent issue because here we are and it's the 21st century and our guts have been suffering. The manifestation of digestive disorders across the globe is skyrocketing. In the United States, 40% of people, that's almost half of people, are having a health-related problem, right? And then, Evan, I'm sure your listeners will appreciate this, but I'm convinced that our gut is connected to so many other facets of our health, including our immune system, our metabolism, our hormones, our mood, our brain health, different aspects of our cognition. And so because of those connections, when our gut suffers, our total health suffers. And I'm completely convinced that the epidemic of Western diseases that we are facing at the moment are connected back to this. And I'm not trying to claim that this is the only issue, right? This is not a silver bullet.
Right.
But if we want to improve our health, we have to address this. It's an important part of it. And so if you want to call me the #1 poo scientist, I welcome that because to me, what we're really talking about is the health of your microbiome. And that to me is like, I'll take that every single day. I'll take that to define the legacy of my career for sure.
Absolutely. I think it's a brand of honor. I meant absolutely no disrespect, but I think it's incredible to be.
I didn't think you did, but I know some people might.
No, absolutely not. And this is going to be a very open conversation about all different topics that I think are incredibly important. What do you think are some of those key pieces of evidence that make you so strongly convicted that the microbiome is having more of a role here than we might have previously thought?
Well, so let me start with just my own personal health journey and describe it because it kind of, I think, unpacks the science as I witnessed it myself.
Please.
So, because this was not part of the mainstream when I was looking at these studies back, more than 10 years ago. I personally had health issues. I was 50 pounds, 20 kilos overweight, more than 20 kilos overweight. I had high blood pressure, high cholesterol, but it was clearly affecting my mood. And my ability to do my job as a medical doctor. So I was depressed, I was anxious, I had extremely low self-esteem. And in that moment, which was my lowest moment, I needed help. But I didn't want the things that I had actually been trained at elite institutions in the United States. I didn't want those things for myself, right? I didn't want to just take a pill for blood pressure, take a pill for cholesterol, take a pill for depression.
Right.
So my goal was to figure out some sort of way to address the root of the issue. And I started with exercise and it failed. And there's definitely value there, don't get me wrong, but it didn't get the job done. And it wasn't until I discovered the power of nutrition that it changed everything. And I was searching for an understanding of why it would be that, for example, the addition of a daily high nutrient smoothie to my routine could completely transform my health. I was trying to understand why this would be. And in 2014, there was a paper that was published in Nature Medicine, which is the top medical journal on the planet. And it was by an author out of Duke University. His name is Lawrence David. And what he did in this moment, we now take for granted because we just sort of accept this as the law of nature. But we didn't know at this time. He put people on 5 days of completely polar opposite diets. So one was a completely plant-based diet and one was a completely animal-based diet.
Okay.
And what he showed is that in just 24 hours, your gut microbiome is changing.
That's a staggering number. It's a staggering number. Whenever I hear that, it takes a second to really internalize that. Because usually my sort of skeptic meter goes up when people say you can have widespread changes in the body or brain very quickly. You know, there's a lot of sort of charlatans out there that will say, oh, change your brain in 10 minutes, you know, like rewire your brain in 5 minutes. I'm always skeptical about that, but I really do believe that in this case, it's true that you can have a fundamentally different microbiome in only 24 hours, but that's quite staggering.
Well, and we have to quantify that, right? Because I think your skepticism meter is appropriate, which is to say that I'm not talking about a radical transformation of your microbiome in 24 hours.
Right.
A detectable change, right? A detectable change that is showing you that there is an effect and we are moving in a new direction is achieved within 24 hours. If you want to radically transform your gut microbiome, how long that will take depends on the individual person. So I've taken care of a lot of people with Crohn's disease and ulcerative colitis. And for those people, it could be months, if not over a year.
Right.
Right. To really get their gut to where they want it to be. Whereas for other people, it may not take so long. To me, typically 4 weeks can be a dramatic improvement, 4 weeks. So, but anyway, in this study, they showed that in 24 hours, the gut microbiome is clearly changing. And there was a signature that existed with these two dietary patterns, and they were very different. And it was interesting because many of the things that we are concerned about with an animal-based diet were showing up in the microbiome in just 5 days. And an example is ulcerative colitis. And some of the benefits that we see with a plant-based diet were showing up within 5 days. All right, so now this by itself is not adequate evidence to like completely transform the way that we think about everything. But this was the first piece.
Right.
And then other pieces start to fall into place. An example, in The Lancet, one of my favorite authors, his name is Andrew Reynolds out of New Zealand. He published a paper that was a systematic review and meta-analysis of the data on fiber. And in this, they included a staggering amount of data. And what it showed is that when people simply consume more fiber, dietary fiber, that they reduce their risk of having a heart attack, of having a stroke, of being diagnosed with diabetes, of dying from heart disease, dying from cancer, of being diagnosed with multiple different forms of cancer.
Wow.
And you see this and you say, hold on. He basically said that if people ate more fiber, that in this one study alone, at least 4 of the top 10 causes of death in the United States would be dramatically reduced.
Staggering, isn't it?
And 95% of America is deficient in fiber.
Wow.
Right? So here's this study saying, here's the benefit. And then here's the data that says that people just are not consuming this. And then the last thing that pulls it all together is you start to think about the microbiome, because the issue, Evan, is that how we have conceived and understood fiber is at a minimum misunderstood.
Right.
Because it's not just this thing that goes in the mouth and passes through the body and comes through the other end and maybe sucks out some toxins. That element does exist on some level, but the really interesting and exciting part of fiber is that fiber bypasses human digestion because we don't have the enzymes, and it arrives intact 15 feet, so 5 meters down in the gut microbiome. It arrives intact, and the gut microbes have the enzymes to unpack the fiber and release what are called short chain fatty acids. And we can get into the mechanistic data, but basically there's a cascade that happens where this event takes place. The fiber stops being fiber. It's magically become short chain fatty acids like butyrate, acetate, and propionate. And then those short chain fatty acids spread out throughout the body and have healing effects in the gut, at the gut barrier, at the immune system, with our metabolism, at the blood-brain barrier, inside the brain. And so the science starts to fall into place where you say, okay, if you believe that fiber is beneficial, then you are required to believe that the gut microbiome is beneficial as well, because the fiber has very limited value without the gut microbiome.
Right.
And then as you start to explore the path of short chain fatty acids, to me, it completely transformed my view of the body and health. It was, now I see it very different than what I was taught in medical school. It led me to want to share this story. That's what led to my books. And the mission has never changed. It's just quite simple that I feel like there's this story that needs to be shared because it could radically transform people's health.
Awesome. I love that. I find it so interesting that we literally do not have the ability to digest fiber without our bacterial friends. It kind of brings up a point that I always like to go to, which is, how did this evolve? Like, we often don't think about how did this superorganism, bacteria, human symbiosis evolve? Like, before we go into all of the health stuff, which I think we're going to cover a lot, I'm curious to tackle that first, about what you know about how the human bacteria system evolved into this magnificent ecosystem.
Well, so I'm smiling right now in the event that people are only listening and not seeing the video. I'm smiling right now because I haven't been asked this question, I don't think, ever before.
Yes.
And I love this question.
Yes.
It's a fascinating question.
I love it.
So, and to answer the question, we have to go back 4 billion years. Now, to contextualize as we move forward, I just want to point out that humans have only existed for something on the order of 2 to 3 million years. So, and that's like different variations on humans, right? It depends on where you want to mark it. Homo sapiens, 150,000 years of Homo sapiens. So we have not been around very long.
Yeah.
And the question is, like, what was the first life on the planet? And it's very clear. We don't know exactly who it was, where it was, what it was, but it was a single cell.
Yeah.
We know it's a single cell, and that's what these microorganisms are. And that single cell somehow got a foothold, survived, multiplied, grew. And as it grew, new characteristics evolved, and it started to spread. And different environments and ecosystems existed across our planet. And with those different environments and ecosystems, new qualities would be advantageous. And if the quality was advantageous, you have a new branch on the tree, right? Where you are now evolving and spreading out into new species. And so it starts with single cells. And eventually, we think about 3 billion years ago, these cells started to smash and pack together.
Right.
And there were advantages to sort of this collective work, right, in teams, as opposed to being singular by yourself. And this was the beginning of multicellular life. And as you developed multicellular life, you had to develop ways to protect yourself, which is where our immune system came from. Okay. But at the same time, multicellular life had single cellular life living on it.
Right.
So there's always been that relationship between single cells and multicells, right? And we characterize that as symbiotic, meaning that there's mutual benefit as a result. Yes. So there's like collective survival together as a result of this. So the point is, as I move forward through evolution, is that there's always been this relationship between single cellular life, bacteria, and things of this archaea, things of this variety that you will find inside of our gut microbiome, and multicellular life of whatever variety. So all life on this planet either is the microbiome or has a microbiome.
Right.
There's no example of sterile that exists in nature, to my knowledge, that isn't man-made.
Right.
Because even in the bottom of the ocean within a rift vent, which is like ridiculously hot and like we're miles deep, there are microbes. Yeah. And the evidence would actually indicate, Evan, believe it or not, that there are microbes drilling miles down into the core of the earth. They've actually found microbes down there.
I didn't know that. In the harshest, most extreme environments of our earth. That's so cool.
We think that they have to be in our minds, right? Because we're rational creatures. So in our rational minds, we think that they must be on the surface. They must be exposed to the sun, or the elements and nutrients and things of this variety. And that's not true. So actually you go miles deep, and these microorganisms, they use such little energy that they live, I believe it's like thousands of years, because they're just not consuming any energy at all. So
cool.
Anyway, so the life on this planet is just...
Yeah, it's astonishing.
Yeah. And you know, everything that I'm describing may sound like science, but to me, actually, it's proof of a higher power in a way, because it's so beautiful and it's so perfect. And so nonetheless, so as we evolved into becoming humans, the microbes are our origin story on some level,
right?
In the sense that we always had a relationship with them. So whoever that very first human was, they had a microbiome, and their survival was predicated on that microbiome helping them on some level, right? And this is how we evolved. There's these little pieces of evidence that exist that show us that we evolved together, and it's proof. I'll give you a few of them. So first of all, and it's going to center around pregnancy and a newborn child, because I think that's where a lot of the evidence is like most powerful. So during pregnancy, mom's microbiome, first of all, is evolving. And it's important that mom is able to get enough energy. I mean, of course, we evolved during times of energy scarcity. So mom's microbiome actually evolves in a way such that it improves energy harvest, which helps mom to make sure that she has enough energy for herself and for a second life, the baby. And this is why also women, their body type changes, where they start to accumulate weight on their hips, right, to sort of balance out the weight that's in the front. The microbiome is responsible for this on some level. And the vagina has a microbiome. That's its own separate ecosystem.
Right.
But during the third trimester, the vaginal microbiome actually changes, and it becomes much more similar to mom's gut microbiome, preparing for birth, because when the baby passes through the birth canal, the baby receives this microbiome. Right. So it's this beautiful gift from nature, which is that the first exposure to the new world is actually microbial.
Wow, very cool.
It's helping to seed the baby, that the baby is not sterile, but the baby's very close as you can get to sterile during your life.
Right.
And receives this gift. And this is part of the reason why vaginal delivery, nothing against cesarean section. I have 4 kids, and they were all born by cesarean, but there are advantages to a vaginal delivery. And this is why people who are born by vaginal delivery, children, are at lower risk for allergic, autoimmune, and metabolic diseases. And then the last example is that mom's breast milk is a microbiome drink.
Right.
So there's a number of different things. There's probiotics in there. There's postbiotics in there, which are things that are produced by the microbes. But the part that I find fascinating is that there's these things called human milk oligosaccharides.
Okay.
And this is mom's breast milk. And these human milk oligosaccharides, HMOs, there's over 200 varieties. So nature has said, we really want to make sure that you have this. There's 200 varieties. It has 0 direct nutritional value to the child. 0. Because It's food for the microbiome. This is effectively the breast milk version of fiber.
Oh, wow.
And it feeds the developing microbiome of the child, which helps to also, similar to vaginal delivery, protect the child from allergic diseases, autoimmune diseases, and metabolic diseases during their young life.
That is so cool. That's such an interesting example. It really is impossible to separate us from the tiny, tiny, invisible, can't touch microorganisms that live inside us. It's a inseparable system, one which each other can't live without.
That's exactly true. And I would make the argument that if you were to separate, we would rapidly die.
Right.
Because we need them. Because we, on some level, we would get exposed to some sort of pathogen and our immune system wouldn't know how to handle it.
Yes.
So we need them in terms of training our immune system. But I also think that like what we're seeing, we could go down the line. I mean, you could literally just shout out diseases and I'll tell you whether or not there's evidence that the science says that dysbiosis, which is a damaged microbiome, is associated with it. But the bottom line is that if you go down and look at the major issues that we're dealing with, they're all indicative of a gut microbiome that's not capable of doing its job at the moment.
Right. And we will touch on a lot of them. Are you familiar with the recent research that just came out last year that supports the idea that the brain has a microbiome? This is something that Dr. William Lee told me on the podcast, because I wasn't familiar with this. I didn't learn this in my neuroscience degree, but there is some evidence now that the brain itself has a microbiome, and there's something like a 20% overlap in the microbes that it shares with the gut microbiome. But a lot is unknown. It's not been proven. It's just been basically in brain samples that should be sterile. It's coming up that there's bacterial colonies there that weren't found before. Are you familiar with this? It's really recent stuff.
So I had not seen that, but what I will say is that I'm not particularly surprised because the concept of sterility is, again, I think that's our rational minds expecting that if something is inside the body and not inside the gut lumen, the tube itself, it's our expectation that it would be sterile, but actually that's not the way that it is. And believe it or not, there's also science that says that a tumor has a microbiome. And in fact, yes. And in fact, there's new data that's been emerging within the cancer treatment space, where if you could sample the microbiome of the tumor, then it gives you some insight into treatment response.
Right. Cool.
So it's, I'm not surprised. There's also evidence that, for example, our oral microbiome, there's specific microbes that live in our mouth. That's our second largest ecosystem. So our gut microbiome is the largest, is 38 trillion. Our second largest is the oral microbiome. And there's multiple examples where they've discovered oral microbes in places that they're not supposed to be. The number one is colorectal cancer. So about 50% of colorectal cancers have a microbe called Strep mutans that we know it's not from the gut, it comes from the mouth. And they've actually found oral microbes in other places as well, including the brain, including in Alzheimer's disease.
Yes, fascinating. Do you think that in the future there could be an antibiotic cure for cancer? Like if you would assume that microbiome is essential to the tumor's growth and to the tumor's survival, if you were able to target in some way that microbiome, in theory, that could cut off the tumor's ability to survive. Do you think that could be a potential therapeutic avenue down the line, or even now? I don't know if it is now.
So what I would say, I think that the origin of your idea is to manipulate the microbiome for the sake of improving health, including, like, for example, cancer treatment, right? And the answer to the question is they're already doing this.
Yeah.
But it's not an antibiotic is what's doing it. In fact, antibiotics. So I'll give you a quick example, Evan. The idea that you had is exactly on point. In melanoma care. So in melanoma care, they have been using an approach called immunotherapy, where the idea is that you actually empower your own immune system to fight the cancer for you. Because rather than trying to, like traditional chemotherapy, the idea is you poison the cells.
Right.
But the problem is it's impossible to be perfect where you target the chemotherapy exactly to the tumor, right? So there's always this fallout that occurs where you're poisoning the whole body, but it's disproportionately poisoning the tumor.
Right.
Right. So the new idea is, okay, well, can we empower the immune system because the immune system, when it's working the way it's supposed to, the immune system is very good at identifying abnormalities and then removing them, including tumors.
Right.
And with this approach, they discovered that people who were taking antibiotics were having worse results.
Interesting.
And at first they thought, hold on, this must be that the patients are more sick in general, right? Like, because in observational data, requiring antibiotics could mean that you're just a sicker person.
Yeah.
Right. So that maybe that's what it is. So they did a randomized trial, and because then you take away that factor, and in the randomized trial, this remained true, that if you give antibiotics to a person before they receive immunotherapy for melanoma, they will not do as well. So this had them thinking, oh, wow, maybe the microbiome is powering the immune system. Maybe you need a healthy microbiome in order to properly manipulate the immune system into treating the cancer. So the next step was they took people who failed immunotherapy. These are people that their melanoma was progressing despite the immunotherapy. And they gave them a fecal transplant.
Interesting.
And they discovered that a very large percentage of people who had failed the exact same treatment previously now had an amazing response after receiving a revised microbiome that was healthier.
Interesting.
And so then this brought them to the next observation, which was, by the way, this is out of MD Anderson in Texas. This brought them to the next observation. So now they're like really on the microbiome concept. So they said, well, how do you empower the microbiome to make it healthier? And the answer to that question is fiber. So, because fiber is the food for the microbes.
Right.
So then they looked at their patients and they said, okay, well, among our patients, which ones of them are consuming more than 20 grams of fiber per day? Now, to contextualize this, 20 grams of fiber per day would still be considered deficient for both women and men.
Okay.
So we're not talking about even fiber sufficiency.
What would be fiber sufficiency number?
So, and it's important to be clear, this is not optimization. This is literally the lower limit of normal.
Lowest limit, right.
Right. So for women, 25, and for men, 38. Okay. So in this, they did a cutoff of 20 grams of fiber per day. Well, the issue is that the vast majority of people in the United States are not getting 20 grams of fiber per day. The average woman is 15, the average man is 18.
Wow.
So with this study, I believe it was 3 out of 4 or 4 out of 5 people were below this threshold of 20. But for the people who were above the threshold of 20, they observed that more than 30% of them there was a 30% improvement in response to the cancer therapy, such that it prolonged their life.
Wow.
So, and that, if a 30% improvement in your ability to live from cancer therapy,
Huge.
Anyone would take that.
Of course. So is fiber deficiency almost a direct proxy of microbiome integrity, like the general health of your microbiome? Like fiber is just that critical. I mean, I can see the book behind you. This is clearly the main message that you want to spread. Like fiber is that critical.
I think fiber is that critical. Yeah. And, and it goes back to the study that I cited earlier about these human endpoints of heart disease and cancer and stroke and diabetes. And there's data for Alzheimer's disease and chronic kidney disease. So now I've named 6 out of the top 10 causes of death in America. Fiber doesn't reduce our risk of having a car accident, thankfully,
right?
Unfortunately, but it is what it is.
Fiber.
Yeah, it's imperfect. So anyway, but is this the key to creating a healthier gut? I would argue yes. And here's the argument. So let me say this. The body is highly adaptable. We have mechanisms in place that allow us to actually metabolically flip and switch depending on what our dietary pattern is. So as an example, people who follow a ketogenic diet, if they are truly in ketosis, the ketones that their body is producing are beta-hydroxybutyrate and acetoacetate. Now you hear these names, beta-hydroxybutyrate and acetoacetate. They're very similar to butyrate and acetate.
Right.
Because the body has actually created this way of preserving this physiology during times of starvation.
Interesting. That's so
Yeah.
cool.
So your body could be starving, and you will produce the ketones that you need to continue to activate these receptors. Now, it's not 1-to-1. Butyrate is superior to beta hydroxybutyrate, and acetate is superior to acetoacetate. Though they don't activate the receptors as powerfully as the original form. So, but if you were in ketosis, you would be able to at least receive the health benefits that come from that. And when we see benefits to the ketogenic diet, my argument is this is the reason why.
So does that pathway bypass the microbiome then, if it's creating the low chain fatty acids, whereas that's usually the byproduct of the microbiome? So is that bypassing the microbiome?
So those ketones, right? Those are ketone bodies. Those ketone bodies are not produced by the microbiome; they're produced from fat. So your body starts basically metabolizing fat, and as it breaks it down, it releases these two things, beta hydroxybutyrate and acetoacetate, and then those things are circulating in your bloodstream and will be given access to the places that, like, for example, access to the microbiome, right? Or access to the gut barrier or to the immune cells, which are the places where the short-chain fatty acids are active. So they're not short-chain fatty acids. They're ketone bodies, but they're structurally similar,
right?
To the point that they can still activate the receptors, but not as well as the original form, which is the short-chain fatty acid.
Very cool.
So, and then the fiber, when we adequately consume this, we are transforming the fiber into these short-chain fatty acids, butyrate, acetate, and propionate. And they spread out and they have healing effects throughout the body. And so they affect our microbiome, improving the beneficial bacteria, suppressing the inflammatory bacteria like E. coli, Pseudomonas, Shigella. If you want to ask me, like, what is the number one thing to repair the gut barrier? The answer is butyrate. It's very clear. Butyrate, every single 3 to 5 days, your gut lining is revising itself.
Yeah, another astonishing fact.
It's turning over more than any other part of your body. And so during this 3 to 5 days, if you have sufficient butyrate, which you need fiber in order to have this, it helps to basically strengthen that gut lining so that you have these proteins to hold the cells together, which really protects your bloodstream. And then immune cells have receptors for these short-chain fatty acids. And then cells throughout our entire body have these receptors for these short-chain fatty acids. And so the point is that these short-chain fatty acids, they're the most anti-inflammatory, most healing thing that exists. We get it from the consumption of fiber. 95% of people in America and about 90% of people in the UK are inadequately consuming fiber at the moment. Okay, so we're not getting what we need there. And we're also not in a ketogenic diet to create the ketones. So basically, our gut microbes are starving. That's where we're at.
Staggering. It's so interesting. You really well detailed out the different pathways and mechanisms there. I'm curious to touch on, how does the gut-brain axis work? So how are tiny little organisms in our gut communicating to the brain? How does that signaling pathway occur? And what types of cognitive processes can it really influence?
I think it can influence all of them, to be honest with you. I think that there's connections that I'm blown away by the power of the gut-brain connection. So let me unpack this for a moment. So, okay, we have two different nervous systems. A nervous system is basically a conglomerate of nerve tissues that function together for a purpose. Our central nervous system is what we classically think of. This is our brain and our spinal cord. But in our gut, we have a nervous system there as well. And it contains 500 million nerves. 500 million. All right, now this number is staggering because the only part of our body that has more nerves than this is our brain. This is 5 times more than you will find in your spinal cord.
Interesting.
These nerves are constantly feeling, sensing, collecting information. and that information will be relayed up to your brain. The way that it gets there is basically through this pair of nerves called the vagus nerve.
Right.
The vagus nerve is the wanderer nerve. It's one of our 12 cranial nerves. It's the only cranial nerve that actually leaves the head and neck area and travels all the way down, connecting to your lungs, to your heart, and to your gut. So 80% of the information that travels through the vagus nerve is from these 500 million nerves that are basically sending information up to your brain. Your brain is using this information to affect physiology throughout the entire body. Right. And like the whole concept of gut feelings, that may sound woo-woo, but I actually think that that's a real thing based upon this. I think this is what's driving those gut feelings on some level. And then 20% of the information is being sent back down through the vagus nerve from your brain to your gut. But there's these other ways that we can send signals between the two. One is short-chain fatty acids. So short-chain fatty acids produced in the gut will travel through the bloodstream, and they will impact the blood-brain barrier. And they will also cross the blood-brain barrier into the brain. And they have a healing effect in both places. The blood-brain barrier has the exact same proteins holding cells together. They're called tight junctions.
Right.
So if you want to repair the blood-brain barrier, because when it's broken, like when the gut is broken, we call it leaky gut. And when the brain is broken, I would call that leaky brain.
Right.
Brain fog, not feeling cognitively sharp, right? Fatigue, low energy. Like these to me are some of the manifestations. So, and the tight junctions are what holds those cells together, and butyrate is what repairs that. So butyrate repairs the blood-brain barrier, and then it crosses into into the actual brain tissue itself. It has an anti-inflammatory effect. So Evan, the emerging data I know that your focus is on neurologic issues, and the emerging data in this space is showing us that neuroinflammation is a driving factor for both mood disorders and neurologic conditions.
Right.
Including
Absolutely.
Alzheimer's, Parkinson's, major depression, right? And if the question is, well, how do we suppress these inflammatory cells? The answer on a powerful level are short-chain fatty acids produced by our gut microbiome. So this explains to some degree the power of the connections between the gut and the brain, because the gut is what is the origin of the short-chain fatty acid that is now healing the blood-brain barrier and is now crossing into the brain to suppress the immune system and reduce neuroinflammation.
Right.
Which to me is a strong part of the argument for why, you could look at the SMILES trial that showed that a plant-predominant Mediterranean diet reduced depression. Or you can look at these other conditions and look at the fact that fiber intake reduces risk for Alzheimer's disease, things like this. This is the reason why.
Right.
So, and then I guess the last thing I would add is that the gut is producing a staggering number of neurotransmitters. So there's over 30 neurotransmitters that are produced in the gut. 95% of serotonin is produced in the gut. 50% of dopamine is produced there. Serotonin itself does not necessarily cross the blood-brain barrier, but there are precursor molecules that do cross.
Right.
And so this is another one of the ways in which what's happening in the gut can influence the brain. And then going down real quick, there's this hormone that's produced by the brain called corticotropin releasing hormone, CRH. And it's basically activation of the sympathetic nervous system that we do when we need to protect ourselves, when there's a threat. And that corticotropin releasing hormone has physiologic effects throughout the entire body, but in the gut, we compromise the gut, unfortunately. So if you think about a moment of stress, like for the listeners at home, you're about to go give a talk publicly and that makes you nervous, right? Or you just almost got into a car accident. Like in that moment of stress, your brain is releasing this hormone CRH, and you notice that the manifestation for a lot of people is actually in their gut. They feel discomfort, they feel queasy, they may get diarrhea. That's why.
So why can we just put short chain fatty acids into the water? Like, why are we not drinking this stuff in large concentrations in drinks? This might be a stupid question, but like, what can we exogenously supplement with short chain fatty acids itself, or do we have to go through our microbe biofactory to produce that stuff?
So the issue that exists is the short chain fatty acids. They are, if you think about the name for a quick moment, short chain, these are very small relative to like long chain fats, like omega-3s and things like this. And so what happens is they get absorbed like this.
If you consume them directly.
If you consume them, they get absorbed like this.
Right.
And so from a physiologic perspective, it's not the same to enter into the first part of the small intestine as it would be for the short chain fatty acids to be released from their origin in the gut to the gut barrier, to the microbiome, to the fact that 70% of the immune system is there in the lining of the gut. It's not the same.
Right.
So I think this is the problem with the idea. That being said, if a randomized controlled trial, to date there is not one, but if a randomized controlled trial comes out and shows us that butyrate supplementation can achieve beneficial health effects, I'll be the first one to celebrate that.
Right. So it's maybe a technical limitation that we have now, but who knows what could happen a decade down the line. It might be the fact that we do figure out how to maybe butyrate in a less absorbed form, attach a few chemical groups on it and doesn't absorb so perfectly or so quickly. It's a possible solution to do that down the line. Not that we should ever ignore the microbiome, but just that it could be sort of a supplementation option.
I mean, my general approach to supplements, and I should mention that I launched a supplement company because I so wholeheartedly believe in the opportunity that exists. And I also strongly believe that we could create much, much better supplements for gut health than what currently exists. So that was my motivation behind creating the company called 38 Terra. And I'm happy to talk about that more, but my general belief in supplements is that I think that there's a place where they're really valuable.
Right.
But we should start with our diet, right? So we should start with our diet. We should address what we can address to the best of our abilities. And we should activate different lifestyle opportunities that we have that include exercise and sleep and morning sunlight and human connection and things of this variety. Like, I think that all of these things, we should make it our goal to start with that solid foundation,
right,
and do it the way that nature prepared it for us, right? And then once we've done that, then to me, the role of supplements is two things. One, addressing deficiencies, and two, optimization. Because it's not just like talking about the fiber earlier, it's not just that you want to hit the lower limit of normal, you want to optimize it.
Right.
So to me, there's an opportunity for us to continue to do those things. And then there's medication, and medication to me should be like the fallback. If you need it, that's your safety net. You can tap into medication, but that shouldn't be your primary approach to dealing with these issues, because you're not really addressing the root of the problem. So it can be very helpful and necessary. I'm not anti-medicine in any way, but to start with what should be the last option, to me, doesn't make sense when you should be starting with diet, lifestyle, and then third supplements. So yeah,
makes complete sense. Let's touch on a few of those lifestyle options. You mentioned corticotropin releasing hormone and stress in general. So what sort of studies have looked at, acute or chronic stress on the microbiome? People that have sort of persistent generalized anxiety disorders or just stress in general. How does stress impact the microbiome, the healthiness, its integrity, its diversity, all the factors that you would rate a microbiome on?
Yeah. So there's the combination of the physiologic basis of this, and then like this is like getting under the hood in the science. And then there's also the just very real human side. So, and starting with the very real human side, which I think that every single one of us can see and relate to, right? Trauma clearly has a negative effect on the microbiome and the manifestation of disease as a result from that. And the reason why is that trauma, not every bad thing that happens in your life is trauma. There's a specific thing that's happening on a physiologic basis in order for it to actually be trauma, which is that, you need to overwhelm your body's ability to cope with some sort of stressor.
Right.
And as a result of that, there's psychological injury that's lasting. It's still there. It's not healed, right? So now the problem is that psychological trauma, it may not be in your conscious mind. For the majority of people, it's something that they don't want to process or deal with, so they push it in away. But it still exists, is active in the non-conscious mind, and it's activating this pathway through CRH because CRH is your response to a threat.
Right.
So if you constantly feel threatened, then this is what happens. You release CRH. CRH activates the sympathetic nervous system, right? So you become sympathetic dominant, which is going to raise your blood pressure, raise your heart rate, increase awareness, and create compromises within the gut where it actually breaks down the gut barrier. And this activates the immune system and it creates inflammation. So I have witnessed firsthand because my mentor at the University of North Carolina was someone named Doug Drossman, who I think would be a great person to have on your podcast sometime.
Yeah, I'd love
because,
to.
So he created the Rome Foundation. The Rome Foundation, for people who are not gastroenterologists, is the origin of irritable bowel syndrome. Okay, so irritable bowel syndrome is this thing that affects between 25 and 40% of people in the United States. It's huge. And yet to this day, we have no test to prove that people have irritable bowel syndrome. It's a pattern.
Oh, I didn't know that.
Yeah, it's a pattern of symptoms where people have abdominal discomfort, they have a change in bowel habits, and that typically their pain, so they could have diarrhea, constipation, or a little bit of both. And typically the pain that they have improves after they poop. Now, Evan, the overlap between irritable bowel syndrome and mood disorders is staggering.
Right.
Massive.
Which makes sense.
Yeah.
Makes sense.
Because they have common origins on some
Yeah.
level. So anyway, my mentor, we used to have a clinic where we would spend hours with one patient. And what I witnessed in that clinic changed my view of medicine because I always viewed it as, okay, it's a physical body. We have to treat the physical disease. And I realized that there's something outside of the physical body. And so we were treating people with trauma who were the people who had been to 5 or 6 doctors. They came in with literally a binder full of tests. They've had every test 3 times. That's because the problem was never their physical issue. Their physical issue was the manifestation of the psychological injury.
Right.
So we had to heal that, right? And then when we did, the physical healing was off the charts. But I would also make an argument that that these things are not just trauma. There is a way in which this is applicable to every single one of us, which is human connection. So you asked me the question that made me very happy and excited, which is that, you asked me about evolution. Think about our origins as humans for a moment. We lived for 99.999% of human history in tribes. And it was a daily fight for survival, literally. Whether that was finding resources or that was defending ourselves from threats, including other humans. And we were better if we were together.
Yeah, absolutely.
And those connections that existed, they became directly aligned with our survival. And you knew, like Evan, if we were in a tribe together, I knew that if we get invaded, Evan's going to step up and protect me. And you know what? I'm going to do the same for him.
I got your back. Absolutely.
Right. And that's where we came from. Right. So we have to understand that hardwired into our body is that natural desire for human connection, because that has always been the measure of health. That has always been the measure of survival. And we've created much more recently, these new human concepts, human constructs of wealth and like, wanting to have a nice house or a nice car and things like
Marriage,
this, and have money.
Yeah.
Right. We've developed these new constructs, but it doesn't, those things actually are like a false totem in a way, like we're worshiping the wrong thing because it's just in a way a distraction, because actually like true satisfaction and happiness actually starts with just the human connection. This is our origin story. So, and I think that in a powerful way, you see this, whether you look at the blue zones across the planet, or just think about us on an individual basis, that when we are connected to one another in a powerful way, we are healthier, We are more at ease. It activates our parasympathetic nervous system, which is the opposite of what I'm talking about with corticotropin releasing hormone. We activate our parasympathetic nervous system by holding hands, by kissing, by hugging, by being in connected relationships with one another. There's so many different ways in which this manifests in terms of our health. And I think that the issue that we have on a very powerful level in the Western world right now is that we're having a crisis of loneliness. People are not connected to one another because the connections that we need are not, hey, someone gave me a like on my social media, right? And therefore I feel good about myself. No. It's not that rational. It has to get down to real connection where I know that you got my back and I got yours.
Right. And how do you think the microbiome links in with our desire and need for social connection? You know, I was speaking to a social neuroscientist called Taylor Guthrie on the podcast a few weeks ago, and we started talking about this really amazing thing about human beings where one of the reasons that we survive in large social networks is that we offload our emotional burden to them. And that allows our behavioral repertoire to be a lot more complex than it would be alone. So we actually need people to regulate our emotions, need people to regulate our behavior. You know, you offload a lot of that to your partner when you have a partner, when you have a tribe, when you have family. Yeah. I wonder how much of that is also works in a similar way to the microbiome, in that you with your partner sort of have this conjoined microbiome, which is more sophisticated, more diverse, and more powerful than even one person's could be on its own.
So you're coming upon the questions that scientists have been asking, and we're starting to see the answers emerging in new studies. And cool. So it's quite fascinating. A quick comment before I dig into answering your question. I just want to say that I totally agree. We do need a partner to offload, but it has to be a true connection. Whereas on the flip side is, like, I feel like Facebook was the start of something that actually was harmful.
Right.
Because when we're connected to 3,000 people, like, we're not, a tribe was never 3,000 people, right? A tribe was 50 people. And so when we're connected to 3,000 people and we hear all of the trauma and bad things that are happening in their lives, we internalize that. And that's actually very stressful for us.
Right.
So anyway, these are the downsides of social media.
Yeah, and which there are many, and which I agree with you on.
Yeah. So, okay, but if we're talking about getting back to organic human connection, why do we kiss? Why do we hold hands? Why do we shake hands? Why do we give a high five and have that be meaningful? Why do we hug? These are universal forms of communication that exist across cultures, across the globe, that were independently developed. Why would this be? I think that there's a compelling argument that the gut microbes are part of the story.
Cool.
So, yeah. So, like, to shake hands is to share microbes.
Right.
And there's implicit trust. I trust that your microbiome is healthy and you're not giving me some vicious disease, right? Some vicious virus or something like this.
Yes.
But with kissing, they've actually found that kissing may be a part of microbiome sampling.
Interesting.
So, yeah. So people are sharing microbes. The number that they've found is about 80 million microbes are being shared during a passionate kiss. 80 million microbes.
It's insane.
Yeah. There's some evidence to suggest that our smells, like our pheromones, are microbial in origin. And that there is natural attraction that we have to certain microbial patterns. And I think we can all relate to this, where you're on a date and there's just something that the vibe is not right. And it's not like a personality thing. It's just like there's something that's there.
You're right.
Right? Your gut sense is telling you something is wrong. And that might be the explanation for this. But I think the most interesting and compelling evidence is that they did this study among couples who cohabitate. And they found that cohabitation leads to the sharing of microbes. Now, naturally, you would say, okay, well, is that just because they're eating the same food? Like, they're sharing meals together. Isn't that the issue? The answer was no. They controlled for dietary patterns, and they found that despite that, people still had the sharing of microbes. And then when they dug into this even more, they found that people with the healthiest microbiome, with the most diversity in their microbiome, were the people that were in lasting committed relationships.
Interesting.
And beyond that, if you scored your relationship as being healthy, in other words, if you said when they asked you, I feel very strongly connected to my partner. If you said yes, those were the people with the absolute healthiest microbiomes, and they shared more microbes together than they would share with their own siblings, which is interesting because, like, you know, if you think about your siblings, you are raised together in the same house, you share genetics, you share the same parents. So in other words, your origin story is basically the same. And yet, despite all of that, these people ended up sharing more microbes with their partner that they're cohabitating with.
Presumably there's a third sort of maybe causal variable there, that both of them are from physical intimacy. You would guess, like, if a couple is healthy, and they perceive their own relationship as being healthy, then there might be more physical intimacy, and then
100%.
Physical intimacy, of course, would obviously increase the shared microbiomes that they have, because what is shared intimacy other than sharing microbes?
That's exactly right. And that's so that absolutely is a part of it, in the same way that kissing can be the sharing of microbes. Physical intimacy would be the sharing of microbes as well.
Right.
And so, yeah, it's like fascinating to think about that.
It's hilarious. The more this conversation goes on, the more I think I'm just a robot that's being controlled by the bacteria itself, and I'm not in charge at all. They're down there plotting and scheming and saying, we need to refill our buddies. Let's go get him to kiss his girlfriend. And I'm not in charge at all. And anything I do is just refueling the army of bacteria in my body that's driving all behavior. I don't know.
You know what? I described this actually in my first book, Fiber Fueled, the way that you just did, which is that I said that you might feel like you're a zombie with your bacterial overlords.
Yeah, exactly.
But there's some interesting research to suggest that cravings can come from microbes. Right. So when people who crave chocolate, for example, there's this interesting research to find that there's this chemical that's detectable in the bloodstream of people who crave chocolate, and that chemical is produced by microbes. So I do think that there's something to be said for this, but no, I don't think that we are subjects to our bacterial overlords. I think that we have a shared relationship with them, but that we have free will. And I think that the issue, though, is that, like, for example, dietary change is hard.
Right.
And that's the issue that we all have, is like a lot of these foods that were designed in the last 100 years that populate the majority of our supermarket, they're like strategically designed to bring us back for more.
Right.
And that's a problem.
I think you thinking you have free will is exactly what the microbiome wants you to think. And it's all just a larger scheme. Like, it reminds me of, is it Toxoplasma gondii? There's a few viruses that do really interesting things in human behavior, and I loved learning these in college because I thought they were so interesting. There's one where an insect will consume some chemical that might have came off the cow's urine or something, and then it makes them crawl to the top of the grass so that the cow eats them, and that's just a virus circulating in its life cycle. You know, there's one that makes is it rats and mice attracted to cat urine so that the cat eats them, and then there's examples in nature of viruses fundamentally hijacking behavior. Now, it's simpler behavior, it's of insects, smaller rodents, but is it so far out of the realm of possibility that there is bacterial hijacking going on? I mean, we also don't fully know the true reason behind why we do something, right? There, it's mostly post hoc rationalizations. You know, we talk about frontal cortex rationalizations for why we do something. I'm fully convinced now that bacteria make all the plans. They're in charge. It's just, how do we replicate the microbiome? And then we just use our monkey brain to rationalize all of our actions based on our self-identity. That's the main takeaway I'm getting from this.
Evan, you started as my acolyte, and now I feel like I've created a monster.
No, of course.
I think it's all quite fascinating to think about, and I think that sometimes, like, those little seeds of truth, they do exist in a lot of these sort of concepts. You know, you watch a TV show like The Last of Us, where the fungi are taking over the brain, and then you like start to dig into the question of like what's possible there, and then the
Right.
answer is like maybe it wouldn't manifest the way it does in the show, but there is on some level some truth to these concepts. No, I think it's quite
Who
interesting to
knows?
think about. I mean, look, let's put it this way: there is zero doubt that these microbes affect our mood,
Right.
right? And so, if you start with that, then it's very clear that there's at least a kernel of truth to this entire concept that we are being manipulated by our microbes. But that being said, what I come back to is the mindset, because the mindset could be, oh wow, the microbes are in control, and therefore I'm just a victim of my microbes, or the mindset could be, a growth mindset, which is what I really try to advocate for, which is to say you have the ability to make choices. And the choices that you make will impact your microbiome very quickly in the way that we have discussed during the conversation today. And then you will yield the benefit that comes from that. So for example, the person who's dealing with a mood disorder, I'm not here to tell you to reject conventional care for mood disorders. I absolutely believe that conventional care for mood disorders is important. But what I'm here to tell you is that you absolutely should be tapping into the opportunities that exist to activate diet, to activate lifestyle. You want to start with something simple that you can do literally today and feel the difference? Go for a walk outside.
Right.
Take your glasses off, go for a walk outside, ideally in the morning, get that morning sunlight. And this is the reason why we have seasonal affective disorder, is that people are spending time inside of their edifice all day. And we would have never been this way because we were basically camping for 99.999% of human history, right? The sun came up, you had to see the sun. Now we never see it. We sit inside.
Is there any relationship between that sun viewing and the microbiome?
Absolutely, because the sun viewing, so there's things that are happening on a physiologic basis. So when we view the sun, it really helps our circadian rhythm in a powerful way. And our circadian rhythm affects the hormones, including cortisol and melatonin. I recently stumbled upon information around melatonin that blew my mind.
Please tell.
There's 400 times more melatonin in our gut than there is in our brain.
400 times. Interesting.
400 times more melatonin in our gut than there is in our brain. All right, now, as your listeners, I'm quite sure are facile, but in the event that people haven't heard of melatonin, this is your sleepy time hormone.
Yeah.
So beginning roughly around like 5 p.m. is the very first beginning of a melatonin takeoff that's going to pick up until about 2 or 3 in the morning. All right. And this helps you to basically get to bed, stay in bed, have a good night's rest. And your body is different at night than it is during the day. Your body is doing different things. Your physiology is different at night than it is during the day.
Yeah.
And so in order for all that to take place, your body is dependent on this hormone to basically signal the rest of the body what's going on. All right. So where does this melatonin come from in our gut? Well, Evan, I mentioned earlier that 95% of serotonin is produced in the gut.
Right.
Let's unpack that. Why is 95% produced in the gut and not in the brain if serotonin is the happy hormone that affects our mood, our energy levels, and our ability to focus? The reason why is because serotonin is also a gut motility agent.
Right.
It helps to get your gut into a rhythm. And rhythm in the gut translates into regular, healthy bowel movements. And when your gut is not in rhythm, then we manifest diarrhea or constipation. And either of those things are associated with damage and changes to the gut microbiome. So anytime you deviate away from a normal rhythm, normal healthy bowel movement, there will be changes that are taking place in the gut microbiome. It's very firmly established.
Right.
So with the serotonin we get when we expose to morning sunlight. It boosts our serotonin levels in the morning, which gives us the energy. And it does affect our mood.
Right.
And it also affects our motility in our gut. So then you have a good morning bowel movement, right? These are the benefits of this. But the key is that the serotonin that was produced in the gut in 14 hours or so becomes melatonin. Serotonin is the precursor to melatonin.
Right.
So when we boost our morning serotonin, we are preparing ourselves for better sleep in about 14 hours. This is a beautiful thing. And then that melatonin that we produce in the gut, where there's 400 times more melatonin in the gut than there is in the brain, is actually helping to repair and restore the gut barrier overnight.
Cool.
There's a healing effect that we get from that. So what I'm saying is that if you give yourself that, 30 minutes outside in the morning, you will be more energized during the day. You will have better mood during the day. You will simultaneously find that you feel tired at night, which is actually the way your body is supposed to feel. You will get a better night's rest that night, and you will be repairing and restoring your gut at night as a result of the serotonin that you got in the morning.
Very cool. I was going to bring up sleep next. How does the process of sleep impact the gut microbiome? How would disrupted sleep impact the microbiome? Can you diagnose a microbiome problem from lack of sleep?
Yeah, they have studies where they put people into a sleep lab and they monitor the microbiome. And there's an interesting thing that happens with sleep deprivation. And I'm an expert in sleep deprivation because I'm a medical doctor. So I spent most of my career being sleep deprived.
In that state, yeah.
Yeah, in that state. And I think that we can all relate to this. When we're very tired, you get a bad night's rest, right? You get 4 hours of sleep. What do you do the next day? You crave simple carbohydrate foods.
Right.
You crave energy. Yeah. And you want that like simple energy source. They've shown that what's happening is actually your microbiome has shifted to more powerfully resemble that of a person with obesity.
Wow.
So I think that there's, believe it or not, those cravings, not to validate the idea that we are zombies.
Control? Who's
yeah,
in
exactly.
Control in your will? I don't know who's in control.
Okay, you're convincing me.
I don't know.
But I think that shift, though, is actually part of what explains that desire to actually consume that simple carbohydrate food, that you have that impulsive desire for food, the lack of self-control there.
Right.
So, and then you can look also at disrupted. So one of the best things you can do for sleep is to establish a regular time.
Yeah.
And be consistent about it. And so like, I think like a good thing to do would be to say 10:30 plus or minus 30 minutes or 10 o'clock plus or minus 30 minutes, something reasonable like this. So they have these studies where you shift your time frame on the weekend, right? So in other words, it's like being jet lagged, except you haven't flown anywhere. You're just quite simply like going to bed at 10 o'clock during the week, and then in the weekend you go to bed at 2 in the morning.
Right.
And what they found is that has negative effects on our gut microbiome.
Interesting.
So even like shifting the timing has negative effects on our gut microbiome. When you are jet lagged, that is the gut microbiome.
That is the gut microbiome.
That is the gut microbiome. They've shown this, that when you are it's your gut microbiome in association with your circadian rhythm, right? That you have disrupted your circadian rhythm. But when you disrupt your circadian rhythm, you are simultaneously disrupting your gut microbiome. And what they showed, they had this study where they had people flying from the United States to Israel. And they checked their microbiome before the flight, after the flight, a couple days after the flight, and 2 weeks after the flight.
Okay.
And they discovered that within the context of jet lag, the gut microbiome was dysbiotic, meaning that they basically had lost diversity and it was unhealthy. And then 2 weeks later, when they were no longer jet lagged, the gut microbiome was exactly where it started.
How many of these gut microbiome problems can you just solve with like probiotics? Like you give all those people on the plane probiotics and they're just eating Greek yogurt the whole way on the plane. Is that just a really like obvious thing that doesn't work? Or like what are the reasons why that doesn't work? Because I presume that doesn't just completely mitigate that gut microbiome disruption, and it's not that simple, which it usually never is.
Well, the question is like, what's the fatal flaw of probiotics?
Right.
Because what we have is a supplement industry that has basically sold us that probiotics are the solution to all gut health problems. Yet the data would say that that's not the way that it plays out.
Right.
All right. So And I want to fully unpack this because I
Yeah.
am a gastroenterologist who has seen thousands of patients who have benefited from probiotics. So I don't want to sit here and make it sound like it's this black and white thing that they're not helpful.
Right.
But the issue is that, number one, Evan, I'll just use you as an example. You have a unique microbiome. There's no one on the planet with a microbiome like you, exactly. All right. And if you had an identical twin, you would have the exact same, 100% the exact same genetic code, and you would only share about 35% of the same microbes.
Interesting. 35%.
Yeah, even among identical twins. All right. That microbiome is established. It's an ecosystem.
Yeah.
Different microbes serve different purposes within that ecosystem. When you introduce exogenous bacteria through a probiotic, when you introduce bacteria from the outside into this system, they're not necessarily going to fit in.
Right.
There may not be a place for them. All right. And then the other problem is that the microbes by themselves are powerless. All right. Because the microbes can't, it's like Newton's law, like that there's preservation of energy in the sense that they can't produce something from nothing. You have to actually give them something to produce. So if you have a microbiome my point is, if your microbiome is starving for fiber and you're not providing any fiber, you can add more probiotics. But if they don't have fiber to produce something from,
Right.
then there's no point.
They can't replicate.
They can't replicate. They can't do anything with it.
Right.
Right. So this is the reason why I tend to believe in prebiotics, which is the fiber and resistant starch. I tend to believe in that first.
Okay.
All right. Now, when it comes to probiotics, so the question is, where do probiotics fit?
Yeah.
And the answer to the question is that there are many different probiotics. There's no such thing as this one probiotic that fixes all of our problems. That doesn't exist. That's a marketing scheme.
Yeah.
But what there are is there's specific microbes that have specific functional purposes. And we can look at the randomized controlled data and ask, if I have this problem, is there a study to show that a certain probiotic strain will benefit me?
Right.
It's got to be the right strain at the right amount for a specific goal. So the probiotics that help constipation are not the same probiotics that would improve mood.
Right. Makes complete sense.
It makes complete sense, but the problem is, like, that's not the way that they're being sold. So we have to push away the marketing and see the actual approach. So for a person who's jet lagged and traveling, I haven't seen like a study where a probiotic is done to provide benefit. Could it work? Sure, it could work. But I also think that what could really work would be actually to make sure you're getting adequate levels of prebiotics, the fiber.
Right. Do you envision some world, say a decade into the future, where we have an app and we open it up and that's our microbiome. We have our full list and it's interacting with sensors in our gut, and assuming this assay is completely accurate and it has a perfect breakdown of the gut microbiome, that whenever you had some sort of problem and you could open up the app, you have a red triangle that's triggering saying this is a critically low, that you could replenish it. Do you think that level of on-demand data related to our microbiome is possible? And would it be as simple as, if you could have exactly the bacteria in the numbers and how much is lacking, that you could supplement it with the prebiotics and the fiber to replenish it and everything else? Is that like a reasonable thing in the future, do you think?
I think it's reasonable. I think it's going to take tremendous effort for us to get there.
Yeah.
So I'm involved with a company. I'm the U.S. medical director for a company called Zoe.
Right, I've heard of Zoe.
And we do personalized nutrition, and the way that we do it, we have over 100,000 active members right now. So what we do is we collect data where we have their blood sugar, because they wear a continuous glucose monitor for 2 weeks. They do a microbiome test using state-of-the-art microbiome testing. And they have an app where they enter in, okay, this is what I'm eating. So during the 2 weeks that they have the blood sugar sensor in, we can like literally see, like, they just ate this, here's their blood sugar, and here's what their microbiome shows. And you can take all of that data and run machine learning algorithms,
right,
and identify patterns. And so there's a quite interesting thing that's available there. Okay. The story, the roadmap of how we get to where you just described is that we're starting from a place with so much data.
Yeah.
Right. Like part of the problem that we had in the past was the computers weren't powerful enough to handle this.
Yeah.
Now we have all this data. And the question is, how do you find the connections? Because our mind is only capable of seeing single linear associations. But it could be that there's a collective team.
Yeah.
Right. And that collective team is working together. So it has to go beyond the intelligence that we have as humans. And this is where I think that artificial intelligence, when we apply artificial intelligence to massive data, it's going to allow us to eventually accomplish what you're describing.
Yeah.
So there are challenges that exist in terms of the quality of the tests that we have. So it's not just a matter of getting a microbiome test. Like, is a microbiome test a true representation of your microbiome? And what's the value of that test 4 weeks from now? Right? Those are sincere questions that we have. But that being said, I think the way that we do this, we're sort of moving in this direction. And I think it's ultimately like the advancement of artificial intelligence that will allow us to take it to the level that you're describing.
Right. Absolutely. What kind of actionable takeaways can people get from a test like Zoe today, where they see something in their microbiome is deficient? Are they then able to take very specific steps to rectify that report?
Yeah, but it's not. I wouldn't. I would be apprehensive to characterize it as there's this one microbe and here's the specific food that you can eat. This is what people want, right?
Yeah.
That's what people want. But the problem is that without getting super nerdy and into the sort of research techniques, that's not what you can deliver with research.
Right.
But what you can deliver is ways in which you can help a person improve their dietary pattern, improve the quality of their diet. And in the process of doing that, improve the health of the microbiome. And what we've seen with Zoe, we did a randomized control trial and found that when people are actually following the Zoe program, they do receive these benefits when they're actually adhering to the program. So, but whether it be doing the Zoe program, which by the way is available in the UK and the US at the moment. I don't believe it's available in Ireland, and it's definitely not available in Spain. Whether it be doing the Zoe program or starting with the application of general rules that I believe are applicable to all of us. So an example of this, and these are things that I discuss in my books, an example of this is that in the American Gut Project, which was, by the way, an international study, not just Americans, they found that the number one predictor of having a healthy gut was the diversity of plants in your diet. The people with the healthiest guts were eating at least 30 different plants per week. So variety. And part of the issue, Evan, is that our food systems don't inherently want us to have this.
Right.
So it's not a conspiracy to deprive us and make us sick, but what it is it's just the consolidation into like a couple specific foods, and that's it. And that's all they provide us.
Yeah.
So we have to be the ones to advocate for ourselves and for our own body, such that when we go into the supermarket, we say, I'm not going to just get the same thing every single time.
Yeah.
I'm going to expand this. I'm going to get more variety in my diet. And then in the process of doing that, you are feeding and fueling the microbiome. So variety within our diet is like a key tool that we can use to accomplish better gut health.
I think one of the most mind-blowing things that I saw when I went to the US for the first time was quite how processed the food aisle is and quite how many sugar variations of everything there are. Ireland's gotten pretty bad for it now. We take a lot of influence from the US. We're a couple of years behind, but I think Ireland's getting really bad now. We're one of the most obese countries in Europe. But if you were to compare a supermarket from Barcelona, Spain to the US, it's like night and day. Yes. There is like, we go to the shop and we go to the fruit shop, we buy tomatoes, onions, garlics, we buy everything separately and we cook it, and that's what people do here. It's hard to find, well, the ultra processed food definitely exists, but it's orders of magnitude less than what you have in the US. Like you don't get like prepackaged food even barely in Spain. It's all just raw ingredients, and people cook olive oil, salt, Mediterranean diets, lots of fish, lots of fruit and veg, good healthy stuff from markets. Like, you just don't get these pre-packaged foods with lots of sauces. It blew my European mind when I went to America for the first time, and I just walked down the sugar aisle, and just every chocolate had 20 varieties of, we just have like a type of chocolate like Snickers or something, but in America they have 20 types of Snickers. It's like that was just blowing my mind, quite how ultra processed the US has gotten compared to places like, especially Barcelona. I think the supermarkets here are quite good.
Well, it's the preservation of those cultural traditions, right? And that's a beautiful thing, that there's a certain way in which people within Spain have traditionally consumed their food, and they continue to do that. And I think if we replace that with a more modern industrialized approach, we run into problems. And I think that the United States, unfortunately, has been at the cutting edge of these particular issues. But the UK is not far behind. Australia is not far behind.
They're catching up quickly. Last time every time I go back to Ireland, I realize, oh God, this is multiplying like faster than like growing up in Ireland. I don't think it was like that. And I don't think it was really like that when I was in college, but now it seems like the ultra processed stuff is blowing up. Spain doesn't seem to really be catching on. Like, again, the chocolate aisle is like this long, and it just has like 2 bars, and that's it doesn't have this massive expansive selection. But Ireland is going to have to do make some serious changes, because we're the most obese country in Europe, and that's not something to be proud of.
No, it's not. And I think that, like, ultimately the thing from my perspective is that, and I'm conscious and aware of European politics on some level. Like, I'm paying attention to it, right? But I'm not in it.
Yeah.
Whereas in the United States, obviously, I'm in it. And I think that, like, I think that there's a general rule, which is that let's not wait for our government to fix our problems for us.
Right.
That ultimately, if we want to receive better results, better health, it starts by like listening to a podcast like this and taking the actionable advice and introducing those things which may be complex, but they may also be simple. Gut health can be, as I've pointed out and made, I think, abundantly clear, we can get intensely complicated with gut health, but we can also be very simple, which is that eat more variety of plants.
Yeah.
Right. And so to me, I think it starts with empowering yourself with that information, introducing it for your own life, introducing it for your family.
Let's unpack the diet segment a little bit, because we've spent quite a lot of time talking about all of the different negatives that happen, the incredible interplay between the microbiome and the brain and the immune system and everything else. But what would a microbiome optimized diet look like?
I mean, so if we go out, I think that there's evidence and then there's the real world. And we have to find where these things converge on one another. Because one of the questions that we have to ask ourselves is, how are people actually willing to eat in the modern world? Right? Is there an approach that's sustainable? So you can't like put this in a vacuum and say, what is the perfect diet for every single person?
Right.
Acknowledging that there's no one size fits all. Looking out into the world, we see different cultures where people are thriving despite the rest of the world around them struggling. And I think the Mediterranean approach is where I would start, to be totally honest with you. It's not the only approach, but the beauty of a Mediterranean diet is that what we're talking about is, like, if you think about it this way, first of all, it's mostly plants. So on a macro level, you are like sort of dominating your plate with high fiber foods, right? So you're making sure that you get your fiber. Now, extra virgin olive oil doesn't have fiber, but it's a healthy fat. And it also has polyphenols.
Yeah.
That's where the spiciness comes from, right? Good extra virgin olive oil, it kind of burns a little bit. It like knocks you back. That's polyphenols that are actually good for your microbiome. So extra virgin olive oil is good for our microbiome, and that dominates in a Mediterranean diet. Yeah. And then we are not, like, to me, I don't like dietary labels, because you could take any dietary label and make it good or make it bad, right? I can definitely make unhealthy vegan diets. I can definitely make unhealthy vegetarian diets, but I can also definitely make any other form. I can make a paleo diet unhealthy if you're eating paleo junk food.
Yeah.
So ultimately, though, what we're looking at is, okay, so when we do consume animal-based foods, what are the ones that are preferential? Well, the answer to that question is fish, shellfish, fermented dairy products, eggs, right? That's what a Mediterranean diet is. right? They prioritize those specific foods. So in a way, what they're consuming is a high quality diet that's a microbiome oriented diet. So we call it anti-inflammatory, but if you say anti-inflammatory, I would say that's because your microbiome is healthy.
Right.
So, or you could go to Japan, different approach, not exactly the same, but they are, again, consuming high quality animal-based foods, including a lot of fish. And their plant-based orientation is more soy oriented. Soy gets a bad name because of the like soy nuggets that people make that are ultra processed, but like edamame is soy and that's incredibly good for you. Tofu, organic tofu, incredibly good for you.
Right.
So yeah, so I guess my point is like there's lots of choices, there's lots of options, and we just need to sort of prioritize higher quality foods and lots of plants.
Makes sense. The one that you kind of, people will notice that you left off the list there would be, I guess, red meat. Is there good evidence for red meat being negative for the microbiome? What is the mechanism there, or what do we know sort of about the relationship between red meat and the microbiome? Because I love a steak. I'm going to be honest, I'd love a steak.
Yeah, nothing wrong with that. So I think that the point from my perspective is that I don't want to present the individual foods as if you having a steak makes you inherently unhealthy.
Yeah.
Right. And that you have decimated your microbiome in the process of doing that. I don't think that that's fair or true. That being said, the discussion around fat and different forms of fat, if you go to the science, from my perspective, the science is very clear, which is that saturated fat actually is harmful to our microbiome. There's an interesting thing. This may be me taking it too deep into the nerdiness, but
let's go.
Okay. Well, I mentioned earlier that there are these. Actually, I don't know if I did mention this earlier. There are these bacteria like E. coli that are pathogenic. All right, they create inflammation, and it turns out that they have this coat of armor that covers them and it protects them. All right, they evolved to have this. It's called lipopolysaccharide,
right?
Or you might hear people refer to it as bacterial endotoxin. Our immune system has been trained to respond to lipopolysaccharide. It creates inflammation. If that gets into the bloodstream, it creates inflammation. Well, it turns out that lipopolysaccharide, lipo means fat. It's built on a backbone of saturated fat. Our immune system responds to excessive intake of saturated fat. In balance, that's not an issue. Excessive consumption with the absence of fiber, that's problematic. So the issue that we have, if I were to like characterize this, Evan, and maybe this is me thinking as an American, the issue that I see is 95% of Americans are deficient in fiber.
Right.
And we're over consuming meat. And so if I have my way, we're going to address our deficiencies, and then we're going to take the things that we're over consuming and we're going to moderate them. It doesn't have to be an absolute thing. It doesn't have to be zero.
Right.
But it's more about moderating them. So if you look at a Mediterranean diet, for example, red meat is in there, but that's not dominating their plate. They're not having a steak every night. They're not having a steak 3 times a week. They're having 4 ounces of red meat once a week.
Right. And from my experience, my girlfriend's Portuguese, and we eat the best food ever when we go back to her small town. But one thing that I notice is that if we do have red meat, or when we have pretty much any meal, it always directly follows fruit. We'll have big bowls of fruit on the table, strawberries, oranges. They will have been picked from the land 5 minutes ago, so they were on a tree. The red meat, that animal was probably in a field an hour before it was on the plate. Like, it's as fresh as you get.
That's amazing.
It's incredible. And
yeah.
The olive oil is growing on the trees, and it's extra, it's absolutely beautiful.
Yeah.
But I have a sense that pretty much always that they would have oranges, strawberries, blueberries always on the table. And it would so how much of that red meat inflammation could you mitigate by directly following it by a fiber source?
I think quite a bit. I think that's the way to present this fairly, which is to say that you can absolutely consume an omnivorous diet. I also think it's radically different to compare, like my dad was an avid hunter, right? And so like it's different to compare a deer that was raised in nature,
right,
against a cow that in the United States was raised at these like specific farming units where they have no space, they don't move, they eat grains all day,
right,
and they're injected with antibiotics.
Yes.
right? So I mentioned in the very beginning of this podcast, this study from 2014 where people did 5 days of an animal-based diet.
Right.
And they had health issues. And so, or at least the microbiome was shifting in a direction that was unhealthy. And one of the things that they found in that is that during 5 days, they developed antibiotic resistance.
Wow.
And the question is why? Well, the answer is not that antibiotic resistance is inherent in nature. It's not. It's that when we unnaturally raise our food, we include antibiotics in that process. So if you inject a pig with antibiotics, you could feed the pig the exact same number of calories. And by destroying the pig's microbiome, the pig gets fat.
Right.
So that's good for farmers.
Yes.
But it's not good for us.
Yeah. Makes complete sense.
So, and this is part of the issue. It's like there's a difference between conventionally raised and unhealthy farming practices that exist in the United States, where people are like, this is the typical steak that a person is buying.
Yeah.
As opposed to being, in a place that's more connected to the land, connected to the animal, connected to the garden and the farmer, which is what you're describing with your girlfriend's family in Portugal.
Yeah, absolutely. You brought up antibiotics there, which reminded me that that's something that I also wanted to ask on earlier. Just how harmful is, doing I'm not saying people ignore their doctors, but when you're sick and you go in and it is a bacterial infection, they give you a course of antibiotics to take over 4 or 5 days. Just what impact are you doing when it's a broad spectrum antibiotic? What sort of impact are you really having on your microbiome after completing your course of 4 or 5 days of antibiotics there?
Yeah, it depends on which antibiotic, whether there's a combination of antibiotics, because sometimes there is, and how long you're taking it for. So like there's obviously different levels of intensity here.
Yeah.
So you mentioned 4 or 5 days, but like I have plenty of antibiotics that could be prescribed, Cipro plus Flagyl in the United States for diverticulitis, where a person is doing it somewhere between 7 and 14 days. Okay. Well, Cipro by itself, which is often used, ciprofloxacin, which is often used to treat gut issues or urinary issues like urinary tract infection. Just a few days of Cipro reduces the bacteria by about 60%.
All bacteria?
Yeah. All bacteria. Because you're not perfectly targeting the pathogens.
Yeah. Well, 60% is not perfect. Like that's quite broad activity, right?
Well, and we're talking, to me, this is a moderate level antibiotic. So, I mean, there's definitely ones that in the hospital we pull out that are way more powerful than this.
Really? That almost just completely eradicate the microbiome for small periods of time. How do we not suffer massive consequences from that?
I think we do suffer massive consequences from that. And so antibiotics, what happens, a few things. First of all, antibiotic resistance is almost instantaneous. Because if you think about it, I said that 60%, there's a 60% reduction in bacteria, okay? Let's pretend for a moment, let's do some math. Let's pretend we start with 1,000 bacteria. And within those 1,000 bacteria, there are 20 that are naturally antibiotic resistant. They just happen to carry the gene that makes them antibiotic resistant.
Yeah.
When we do 60%, we're now down to 400 bacteria. And out of the 400, 20 of them are antibiotic resistant. So they're way more powerful than they used to be. They're way more powerful. And now they're going to grow and multiply because we created a lot of space. There's a vacuum.
Right.
Yeah. So they're going to grow and they're going to multiply. And so now going forward, antibiotic resistance is there. Okay. It might not be enough to stop you from using the antibiotic the next time, but it's definitely more powerfully represented. The second thing is that you develop an antibiotic, what we call an antibiotic scar. So when we injure our body, if it's a deep enough injury, then there's something that sticks and you continue to see it. We call it a scar. Well, in the gut, if you were to measure a person before and after antibiotics and continue to monitor their microbiome on an ongoing basis, you would notice that after the antibiotics, they never fully recover.
Wow, that's crazy.
So there's some level of injury where you can point to and be like, okay, this is where they were before the antibiotics. This is where they are now. Here we are a year from now, and we still can see this difference.
Right.
And we call that an antibiotic scar.
I'd never heard of
So
that term. That sounds deeply terrifying and makes complete sense of why that would be a really big deal.
yeah, and then there's been the emergence of pathogenic bacteria that take advantage of our vulnerability and susceptibility. So many people would think about, of course, fungal infections. So that's not a bacteria, that's a yeast. But you take antibiotics, you get thrush, right? Well, the reason that this happens is that you are suppressing the good bacteria, and because you're suppressing the good bacteria, this pathogenic yeast is now multiplying and is taking over. In the same way that a woman gets a yeast infection.
Right.
But there's also this bacteria called Clostridium difficile. They've actually recently changed the name. I find it very annoying that they did this. They changed it to Clostridioides difficile, but we still call it C. diff.
I'm sure everyone listening is also annoyed by that name change. It's really
we-
impacted their lives.
we had, I don't know how many years of sitting in the hospital talking about these patients with Clostridium difficile.
Right.
And then it's like, one day they decide, hey, we want to give that a different name. Do you have to give it a different name?
Got to rebrand. Yeah. I
Yeah.
get you. Yeah.
All right. So anyway, but it's still C. diff. So this C. diff, it happens after people receive antibiotics. You probably have it living inside you. I'm sure I have it living inside of me. And it's not causing a problem when our gut ecosystem is healthy because the good bacteria suppress it. So the existence of these pathogenic bacteria within a healthy microbiome is not of concern. There's no issue there. But when you take an antibiotic, like the classic for this is clindamycin. Clindamycin wipes out the antibiotic. It wipes out the good microbes. And then next thing you know, this thing surges.
Yeah.
And you get this rip-roaring infection of the colon called colitis. The colon is raw, bloody, you have diarrhea, and it can be life-threatening.
Wow.
I've also had people who have had to have their colon removed as a result of this.
Wow.
Now check this out. This is the fascinating thing. About 15 years ago, I was in my gastroenterology fellowship. So I was training to be a specialist. My total training from the beginning of college to when I finished was 16 years.
Wow.
So I was training to be a gastroenterologist. I was in my early 30s, and we had these patients that we just couldn't get better. Right? Because the problem was with the C. diff, because the problem was that you would try to treat with antibiotics. But the problem of treating this with antibiotics is that you're inherently destroying the other bacteria that you need to suppress it.
Yeah.
So you get into this vicious cycle of treat with antibiotics, it comes back. Treat with antibiotics, it comes back. So you have to repair the microbiome. So guess what we did? We were desperate. It's like 2010. And we were desperate. And we turned to the most, I literally with my own lips would characterize this as the most disgusting source possible, which is that we started doing poop transplants.
Wow.
And we took the stool of a healthy person and we put it into this person who has this unremitting infection. And what's fascinating is that I'm just going to tell you this. It's like a miracle.
It worked?
Because, you do this and these people who are like on their deathbed, I'm not exaggerating when I call it this. They're on their deathbed. You do this, and 2 days later, they walk out of the hospital with normal bowel movements.
Insane.
It's insane.
Completely insane.
Now, everyone's going to hear this, and they're going to say, "Does this mean that I need a fecal transplant?" And the answer is no.
Okay.
Because this is to treat an infection. So, in theory, if you can restore the structural integrity of a healthy microbiome even on a temporary basis, the infection goes away. All right. That shows you how powerful the microbiome is.
Right.
But if you have ulcerative colitis or Crohn's disease, these are people that have microbiome-based chronic health issues. And if you give them a fecal transplant, the problem is that that's not a sustained change. They haven't changed their diet. Those microbes die off.
Right.
Okay. So doing a fecal transplant for those people by itself is not adequate. Now, could we, in theory, do multiple fecal transplants and simultaneously a dietary change with fiber? I think the answer is potentially yes, and that's where the science needs to go in the future.
Interesting. That's so interesting. How do you do a fecal transplant? And who do you decide who has the best feces to do it?
These are interesting questions. So at the moment, in the United States, there's only one approved indication for fecal transplant. So if a doctor wants to give a fecal transplant, it's for what I just described, which is this infection.
Okay.
Okay. There are research studies that exist that are looking at fecal transplant. And the reason why we're not just like casually giving this out to whoever is our experience with blood transfusions 40 years ago, 50 years ago.
Like a reject.
Back in the 1970s, they started giving blood transfusions to people, and they didn't realize that they were actually giving people hepatitis C.
Right.
Because they didn't even have the technology to detect what they were doing.
Right.
So we're cautious.
There's no known about what you could be giving them from this feces.
That's exactly right. So, and there's been these wild, bizarre reports of people saying, you know, I was skinny and then I got a fecal transplant and then I became obese and things like this. Like there's all these wild, you know, it's like a single case. What do you make of that? Who knows?
Yeah.
But it does exist. So anyway, so in the United States, you can only do it for this infection. We do have research studies where we can do it for more. The way that we do it is the way that I always did it is I would do a colonoscopy. So I'm a gastroenterologist. That's a huge part of what I do. And basically during a colonoscopy, the person is asleep and you go in and you basically go all the way through their large intestine, which is about 5 feet long. And then when you get to the end of it, you start to release the fecal transplant, and it's a liquid.
Right.
So you're not putting solid poop into a person. You're putting.
I figured there was a more elegant solution that in the innovation
it's
and the
as elegant as you can make this kind of thing.
Yeah. Okay. Makes sense.
So, but anyway, you do this all the way through the colon. So you're basically like spraying this this liquid, and it comes from a bank of stool where they test it extensively, because again, like we want to make sure that we're not transferring some sort of virus to the best of our ability. So there's this stool bank that exists in Massachusetts, and they basically do all the testing for us, and then you receive it frozen, you defrost it, and you administer it. You could also do it technically through a tube in the nose. So you could drop a tube down into a person's stomach, of course, you know, bypassing everything.
Yeah.
And put it through that tube. And you could do that. The issue is that it has to travel through, you know, your small intestine before it even gets to your colon. So it's diluted out a bit on some level by doing that. Whereas if you go straight into the colon, then you're directly administering it where it needs to be. So that I think there's advantages to that.
And that's also presumably the reason that you can't just take a capsule or something?
Interesting. You got great questions. Thank you, Evan. I really enjoy this. I like that you think this way. So there's a movement towards capsulization of this, but in order to encapsulate it and have it be safe, they have to freeze dry it.
Okay.
And so now this may sound kind of wild, because like again, our rational mind would say that if you freeze dry it, you kill it, right? So it can't be alive. It can't do anything. But actually, believe it or not, there's also these studies that show that you could literally kill the microbes and they still provide benefits.
But they can't replicate, obviously, if they're dead.
No, they can't replicate, but there's aspects of the like cell wall that are a part of the bacteria that still provide benefit, believe it or not. Yeah. And we characterize these as postbiotics. So we mentioned probiotics, which are live microbes.
Yeah.
And we've talked about prebiotics, which is where my big belief is, and that's fiber and resistant starch and polyphenols.
Yeah.
Okay. But then postbiotics, it could be butyrate, it could be short chain fatty acids, but this is a very broad, diverse category, because it also involves heat-killed microbes.
Heat-killed microbes, okay.
Heat-killed microbes, and you can take this like a probiotic, but it's not alive. So it doesn't matter whether you refrigerate. It doesn't matter if it was exposed to heat during like travel. It's already dead. We call it a zombie probiotic.
Excellent name. Love it.
And there may be benefits to the zombie probiotics because again, they're more reproducible. They're more consistent.
Strange, because it's kind of going against the conventional wisdom that you want to consume the bacteria so that it can replicate and actually so you can build the colony inside.
That's exactly right. But the point is that even dead bacteria have effects on the microbiome that may be beneficial. And that's what's happening there.
Interesting. That's so cool. Fecal transplants are weird. And I've heard you talk about some really crazy things that I wanted to confirm with you. Things like if you get, there's been studies where they have taken a fecal transplant from somebody with depression, and they have given that fecal transplant to a mouse, if I'm not mistaken, or a rat. And then that rat/mouse has adopted the behavioral phenotypes of depression from just the fecal transplant. Is that accurate?
That is correct.
That's kind of crazy, isn't it?
Well, it gets back to the idea of there being a microbial phenotype within your gut that's affecting your mood. And what they've shown in human studies is that people that have for example, major depression, so diagnosable mood disorder, not just like, hey, I feel bad, but like actually like a true mental health disease, that within that context, these people have a damaged gut microbiome that we would characterize as inflammatory. And what's missing? The answer is the short-chain fatty acid producing microbes. And the pieces of the puzzle start to fall into place because I mentioned quite a bit earlier that neuroinflammation, inflammation inside the brain, is associated with this diagnosis, major depression. And so it's kind of interesting to think about the effects that the microbiome could have on the brain because of the absence of short-chain fatty acids that we need to achieve a good balance in terms of the brain and nervous system regulation.
Right. It's so interesting. And what were you gave a few other examples, I think, of a disease or illness that was basically transplantable into the mouse from the fecal transplant. Do you have any other examples of that? Because I thought that was just...
Diabetes is... Yo, absolutely. They have studies actually in human adult men where they gave them a fecal transplant. Human men received a fecal transplant and their blood sugar control improved. Okay. But the problem was it only did for a few weeks. So it gets back to the idea that I said of like, if you give someone a fecal transplant, but you don't change your diet, those microbes are going to die off. So the benefit that they received was most profound in the moment that they received the fecal transplant. And then the effects were diminished as the weeks passed on.
Right.
So there's research studies with mice. So an example is they had this one study. This has been done a bazillion times. This is actually like the origin of microbiome research back in 2005, where they started to look at obesity and dysbiosis, damage to the microbiome.
Right.
And I think my favorite of these types of studies is where they took identical human twins that were discordant in terms of their body type. So in other words, just to unpack what I said, that these people, they're identical twins. They have the exact same genetic code, but one is obese and one is skinny.
Right. That's going to be rare, right? It's going to be hard to find those. To have an obese and skinny identical twin, that's like identical twins are rare on their own. That's going to be a small sample size to find those.
Yeah, well, it's interesting. The scientific founder of Zoe that I'm associated with, his name is Tim Spector.
I've heard of Tim Spector, yes.
Yeah, he's one of the most published scientists in the world. He's a famous scientist at King's College London. And his personal scientific origin story is that he wanted to study genetics. So he started with twins. And he built the world's biggest database of twins, identical twins, fraternal twins. And that helps you to sort of unpack and understand genetics, right?
Yeah.
If you can look at like what happens when people have the same genetics versus not the same genetics. And what he discovered is like genetics doesn't explain it all. So this is where he went looking for something else, and he came into the microbiome. And then it became the principal focus of his career because he started to feel that this is more powerful than our genes. Not to mention that our genes we are born that way, but our microbiome we can change.
That's some statement, right? That the microbiome is more powerful than your genes.
I think so.
I would love to see a debate with. I had Dr. Robert Plomin on the podcast. Are you familiar with? He's one of the godfathers of behavioral genetics and has ran the TED study in the UK, which was the longest longitudinal study of identical twins, and has written loads of books about how personality is 50 to 70% heritable and all of these different things, and has been a really pioneering figure in that space. I would love to set up a debate because I would guess that he would take the opposite stance, that he thinks that genetics is more important, the DNA is more important than the microbiome. But who knows? It would make for an interesting conversation at the very least.
Yeah. Well, I think that it's important to acknowledge that like these big stroke statements, like if I had my way, we would spend an hour going into the detail of unpacking something. So example, like cystic fibrosis is 100% genetic. It has nothing to do with your microbiome. It will clearly impact your microbiome in a powerful way.
Yeah.
But it's not caused by the microbiome.
Yeah.
There's other health conditions like celiac disease, where celiac disease, if you don't have the gene, you can't develop the condition.
Yeah.
But in the United States, a large percentage of people have the gene. And 97% of them do not develop celiac disease. Only 3% of people who carry the gene for celiac disease actually ever develop it. So the question would be, what is it that causes that 3% to activate the gene?
Right.
And the emerging evidence is suggesting that there's gut microbiome origins that explain that.
Interesting.
Which would explain why a person could, for example, go to a foreign country, get an illness, like get diarrhea, a traveler's diarrhea, and then come back and the diarrhea doesn't go away and now they have this health issue.
Right.
Right? That's lasting. That's not the diarrhea that's sticking around. That's that they now flipped on their celiac gene.
Yes.
So there's a give and take, because like your genetic code clearly informs your risk of disease.
It's a nuanced question. There's lots of different facets to it for sure.
Exactly. So it's not, and to me, it's not an all or nothing phenomenon.
Yes.
It's the complex interplay. Right.
Yes.
So I think all of us, though, like if I were a geneticist, I would think that it's genetics, and as a microbiome guy, I think that the microbiome is really important for this. So nonetheless, with the obesity, basically what they did is they had these twins that were discordant for weight. One was obese, one was skinny. They have the same genetic code. And so then what they did is they took their microbiome and they transferred it into two animals. So I believe it was mice. So it's hard for me to keep track of mice versus rats because it's...
Yeah, they're interchangeable, I think, for the listener. Yeah, and for, whichever.
Yeah. So anyway, but I believe it was mice. And they transfer the microbiome, right? So the obese microbiome goes to a mouse, and the skinny microbiome goes to a different mouse. And these mice start with the same body type because they actually were born with no microbiome.
Right, so they have a gene knockout or something that lets them be born without a microbiome.
They developed these special mice that are used in laboratory studies where the mice are born into a sterile environment where there are no microbes.
Right.
So they're able to create, and that by itself is like a fascinating research study, because that they by themselves, there's like they're like paranoid and anxious and have trouble getting along with other mice, and there's all these different consequences that exist when they don't actually have a microbiome.
Interesting. And even on that point, 'cause that's really interesting to me. If you keep them in a sterile environment, they won't develop any they don't get a microbiome at birth that is somewhat persisting since the very start, or that would that
because the issue is that they are born to a sterile mother.
Okay.
And they're born within a sterile container where there are no microbes.
Okay, so the whole
and then they're maintained that way because they're for research purposes.
Right. No, makes sense.
So they're maintained that way until you give them a microbiome. So, and with these studies, it's quite common that it's kind of interesting to think there's a microbiome code where you could translate from humans and a human microbiome into an animal and still see these effects.
Yeah.
Right? Like that's
crazy.
Fascinating.
It's crazy.
Yeah, so it's across species.
Yeah.
Right. And so anyway, but they do. And in this study, they fed these mice the exact same food, the exact same number of calories. They ate the food. So they're not eating different amounts of calories. And the obese mouse became obese.
Oh my God.
And the skinny mouse was skinny.
On the exact same caloric intake.
The exact same caloric intake, because
mind-blowing.
There's efficiency of digestion. So like we think about ideas like, for example, within the fitness world, there's, people who will track calories.
Yeah.
Right. And get themselves into a calorie deficit for the goal of losing weight and burning fat. there is no doubt, I'm not disputing the value of calories and the need for a calorie deficit in order to lose weight. That is 100% a fact of science, that you have to be in a calorie deficit to lose weight.
Yeah.
But the what I'm disputing is the efficiency of our digestion,
Right.
and access to calories. So the skinny mouse is likely pooping out more calories. There's more
Right.
calories in their stool, and there's less calories that are being absorbed in that mouse, as opposed to the obese phenotype mouse is more efficiently harvesting energy from their food source.
Right. That's such a cool study. I have like a list of studies that I call like my pub studies. Like they're so interesting, I'll tell my friends in the pub. And I think that's going to be added to the list. That's so interesting, on exactly the same caloric intake.
I mean, I feel like we got a couple different pub studies. We got the zombie talk. We got the...
Absolutely.
Because actually this ties back
cool.
to, in a fascinating way, it ties back to our conversation earlier about pregnancy and how mom's microbiome has a shift towards an obese phenotype. Right. So mom's microbiome during pregnancy shifts towards an obese phenotype to help facilitate the energy that is necessary for mom and baby to be healthy and for mom to put on weight, including on her hips.
Yeah. So I'm thinking about pitching that experiment to a grant committee where you're like, okay, here it is. We're going to get twins. One of them's going to be obese and one of them's going to be skinny, and they're both going to poop, and we're going to put them into mice, and we're going to see what, like, it just sounds crazy from top to bottom. Like it's genius. And the result that it came out like that is insane, but it just sounds completely bonkers to anyone until you get the result.
But Evan, the funny thing is, like, we're talking about actually, these are like in some ways the microbiome origin stories, because we didn't have the research technology to study the microbiome until about 2005.
Right.
And the other thing, I mentioned this earlier, we didn't have the computer power that we needed in order to really handle the data. There's so much data that exists in the microbiome. And so this started in 2005, but the study that I just described for you, I think it was published in 2008 or 9.
Yeah.
So these are actually old within the microbiome space. But the funny thing about it is that research has shown that it takes 17 years for something that starts as a research paper to actually make its way into the consciousness of healthcare providers.
Interesting.
So we're not even at 17 years yet.
We should work to really decrease that 17 years. One thing that I constantly think about it is how to reduce the size of the huge wall that exists between academia and the general public. So that
we're doing it.
Yeah, I mean,
we're doing it right now.
Yeah, exactly. That's exactly my point. I think podcasts and just scientific communication is absolutely the best way to do that.
Scientific communication, because the issue is that I, like, for example, when I write a book, up until the day that I turn in my manuscript for publication, I'm literally pulling papers. And so, like, if you read a book of mine, you could literally go to my references. My books typically have like something on the order of 600 to 900 references each. And so you could like literally go into the references, and what you'll see is you'll see a hard stop date, because you'll be able to tell. It'll be like, like if I were to publish a book right now, you would see references from 2025.
Right. Very cool. I'm going to challenge you to do something difficult, because I know you've dedicated so much of your time to communicating about the microbiome and talking about it. I think it's such an important mission. But where do you think microbiome claims might be overblown? I've seen so much news coming out linking different papers to autism. I am linking very directly to depression. I've had guests on the podcast who are very skeptical of the microbiome links with depression specifically. This person, name is Dr. Kevin Mitchell from Trinity College Dublin, very intelligent guy. He believes that the results from those papers are basically statistical artifacts, and people not correcting the statistics correctly in finding these correlative associations between, very large, because we have such a vast number of bacteria, and some of these papers are finding correlations between bacterial colonies, but maybe some of the papers aren't completely coalescing and they aren't completely agreeing, because one paper is finding this colony and another one is finding this one. I genuinely don't know, but I really wanted to get your opinion on, do you think there's anywhere you could say that the connections maybe just aren't that tight yet, or the claims have been stretched a little bit, or where are you a little bit more skeptical? What haven't you adopted entirely, do you think?
Yeah, so I I think that the listener needs to understand that academia is designed with its foot on the brake for good reason, right? Like actually a part of the academic process to push back against ideas, to challenge them,
Right.
right? And if we don't do that, then we create bad science because then we're too quick to publish.
Absolutely.
So, and so I think that there's a healthy element to this. And I think what the layperson doesn't see or understand is that we've been doing this since the dawn of like academia, since World War II, where scientists go to meetings and they challenge each other.
Yeah.
And that's healthy debate. It's not personal.
Yeah, exactly.
Right. And the problem is that you put a face or a voice on the internet and then it feels like it's personal, like they're attacking that individual. But no, this is just like healthy debate. So that's okay. That's good.
Exactly. That's why I wanted to bring it up. I thought you would deal with that well.
Yeah, well, and I think that the challenge that we have, there's a few, all right, and I'm going to try to distill this down to like what I think the honest truth is. I think that part of the problem is that like there's a lot of voices out there, and I can't, nor can any of us be responsible for every single voice that exists, and every single thing that I hear that I disagree with. And if I devoted my time to identifying the things that I disagree with and trying to correct it, I wouldn't have time to actually talk to you about what I believe.
Right. Of course.
Right. So I've actually chosen for myself to take the position that I'm going to be my own voice of truth. I'm going to be honest. I'm going to work hard to deliver what I think is scientific truth to the people who believe in me and support me. And I'm going to leave it at that. And then other people can do what they want with that. You can choose it. You can choose to accept it or decline it. You can check my references. I provide them. I always do. All right. So now the problem is like, a term might be leaky gut. All right. And we start running with this. The term is not inherently wrong, right? There is such a thing as increased intestinal permeability. That's breakdown of the gut barrier.
Yeah.
So there's a lot of truth to that. The problem is that you get all these other things that sort of get packaged with the idea of leaky gut that are not actually scientifically accurate.
Right.
So sometimes separating the scientific truth from all the baggage that's riding with it can be quite challenging when it sort of goes through this echo chamber on YouTube and people are just getting crazy with it. And next thing you know, what came out on the other side is something radically different than how it started.
Right.
Right. Another would be small intestine bacterial overgrowth, SIBO. So I have serious concerns about this because I feel like it's become almost like a trendy diagnosis to say, hey, I have SIBO. Like a lot of people, if they have bloating and gas, they're like, I have SIBO. Having bloating and gas does not inherently mean that you have SIBO. And some people who are constipated, they will say, I have methanogen dominant SIBO. All right. So could this actually cause a person to be constipated? Potentially, yes. But the problem is, the reason why I'm sensitive on SIBO, and by the way, Evan, I apologize please interrupt me if I need to unpack this in more detail, but the issue with this diagnosis is that if you say that the physiology, the root cause of your problem is the excessive growth of bacteria or methanogens, then the next choice is to take antibiotics. And I've already told you what antibiotics do.
Right.
There is nothing that destroys the microbiome faster, and it never makes a full recovery.
Yeah.
And when I was, so I would have these drug reps that would come into, this might be an American thing, but these drug reps would come into my office and they would say, for your patients with IBS, with diarrhea, here is our antibiotic. It's called rifaximin. And we would encourage you, this is literally what would happen, to write the prescription with 2 refills, because then they won't call you. When they pick it up, they can take their antibiotic. They take it for 14 days or 7 days. What do you think it's doing to their microbiome?
And then they refill it twice. So that means
then they can refill it twice without you even knowing it. And then they come back and they've done 3 courses of antibiotics.
Holy crap.
All right. And they're not better for it. And the problem with this is that there's understandably for the patient, confusion because they're reading about SIBO, they're hearing about SIBO, they take the antibiotic, and the interesting thing about it, Evan, is that during the antibiotic, they don't feel unwell. They feel better.
Right.
Why would that be? Because the reason that they feel unwell is due to the bacteria. So while you're on the antibiotic, you have destroyed the bacteria.
Yeah.
And then you withdraw from the antibiotic and you stop, and then like your entire problem comes back, except with even more force. It's even a bigger issue than it was before. What's actually happening on a microscopic level is that you're descending deeper into dysbiosis, right? And I'm of the belief that the solution to our problems is not the destruction of our bacteria. I'm of the belief that the solution to our problems exists in the building of healthy bacteria. We should build up the good ones. Because as I've shown you with my data and evidence with the fecal transplant, there's quite power in healthy microbes to suppress unhealthy ones. And so I think like SIBO to me is like a big issue that I see where people are like being very quick to rush to this diagnosis. And then they're doing all kinds of like either antibiotics or they're doing protocols based upon antimicrobials on the internet. And it's like antimicrobial, antibiotic, we're talking about the same thing.
Yeah.
Right? Those are synonyms. So like those are examples of things that I see. Let me be honest with people, that you can agree or disagree on the role of the microbiome. You can agree or disagree, and that's okay. But I don't think that you can agree or disagree when we have overwhelming data to support the role of diet or the role of lifestyle, sleep and exercise and human connection. All right. And I might sit here and say that I can show you the data of how the microbiome has changed as a result. And I will feel that it's completely indisputable because, as I said at the very beginning of the show, fiber would have very little value without a microbiome.
Right.
The benefits that we get from fiber are because of the microbes. So if you believe in what almost every single nutrition expert in the world would agree is the most indisputable fact of nutrition, that fiber is good for us, if you agree with that, then you must believe in the microbiome. It would be cognitive dissonance to not see that.
Yeah. That makes complete sense.
Yeah. So I think, and so this is the way that I generally feel about it, is like you can agree or disagree on whether the microbes are actually directly responsible. I think that like these studies where they do a fecal transplant are quite convincing that the microbes are at least playing a role. Right. I am in no way making the argument that the microbes are 100% puppeteers controlling everything about us.
Yeah.
Right. But what I am arguing is that I think that they're an important part of the story. And at the end of the day, if I have my way, I'm going to motivate you to improve the quality of your diet, to exercise, to sleep, to spend time outdoors, to spend time loving on another person and getting connected to other people. Like if I have my way, that's what you're going to do. I believe that it's going to result in better health. I believe that it's going to bring more joy to your life, make you feel more fulfilled, give you a purpose. And I do believe that the microbiome is part of that, but you can take it or you can leave that part of it as far as I'm concerned. That's not what matters.
I think you've made a very, very convincing argument. I think the main thing that Kevin had a problem with was the connection with autism. And I think it was because of a fundamental kind of a misrepresentation of what autism is as something that is curable, a state that is, you can have someone that is autistic, which is basically just an atypical behavioral phenotype, slightly atypical and, very hard to categorize. And people are kind of drawing these mechanistic dots with the microbiome because it's trendy and it's sort of, it can be, I think, harmful for one in general for proper autism research and science, which is again saying that it's a curable state, like we can get someone out of it, as in insinuating in the paper that if we corrected that microbiome, that the person that had autism might also snap out of it, or would fit more narrowly into a sort of typical behavioral phenotype. But I think that's always going to happen, and I think you can always say that some of the research is going to be grasping at straws without disparaging all of the amazing microbiome research. And I think all of the incredible things that you've said and how you've detailed and how you've laid it out. And, You fully convinced me that I'm going to need to consume more dietary fiber anyway, and I'm sure you've convinced many others. But do you have any kind of points on that autism point? Yeah,
of course.
Yeah,
of course I do. I think so, and you can literally see this in my work. I have very serious concerns about the vulnerability of the people who have autism and the parents.
right. Exactly.
So I'm a father of 4 children, and very proud of being a father, and so I feel extreme sensitivity and protection for these people, which is the exact reason that you will never hear me on a podcast talking about the use of the microbiome for the treatment of autism.
Right.
It doesn't exist. You can't find it anywhere on the internet, and you won't find it in my books either. And the reason why I won't go there is because it's a vulnerable population, and I'm sensitive to that.
Right.
Do I think that there might be a microbiome basis to the manifestation of autism in terms of the development of the disease or the development of the condition? Do I believe that there may be a microbiome basis? Yes, I do believe that there may be a microbiome basis. Do I believe that there are singular or simple solutions that exist in order to cure autism? I do not believe that that is true.
Right.
So, and I think that there's a lot that we still need to learn. And I think that there's this rush. I think that this is what he's, I'm sure, sensitive to.
Yeah.
Is that there's a rush by desperate people to find answers and find hope and find solutions, because it is hard.
Yes.
Hard to be a parent, period, but it's even more hard if you have an autistic child.
Right.
And I think that because that exists, then it also exists that there are people who are like very quick to, oh yeah, here's your solution, here's what you have. And that's, to me, we would describe that as a charlatan.
Yes. And you get into very horrible ideas of people selling the cure to those vulnerable populations, because they don't know the science. It's not inherent on the parents of children that have autism to be fully understanding of all of the neurodevelopmental intricacies. It's incredibly complicated. So you are just cautious for those vulnerable communities. Well, this has been so much fun. I've enjoyed this conversation so much. I'm glad that it went in areas that you might not have been asked before, like evolution, like crazy fecal transplant experiments. I have a list of more questions, but I've just enjoyed this so much. I want to leave with one final. What would people do in 2025 as a simple takeaway to improve their microbiome, to ensure that they're feeding those microbes that may or may not be controlling our behavior? I'm fully convinced they are. In general, how do we have the healthiest microbiome in 2025? What are the best takeaways for our listeners of the podcast that have made it 2 hours into us rambling about tiny little organisms?
I think if there's one takeaway that I would really, really love for people to have, and I mentioned this earlier, but I just want to re-emphasize it because it is the thing. It is the thing. It's what I focus on in my books. It's adding more variety of different plant-based foods to your diet. So that's fruits, vegetables, whole grains, seeds, nuts, and legumes. All right. And by the way, mushrooms technically are not plants, but I would throw them in there as well because they actually have a lot of the functional properties that plants do. So that gives us the fiber, the resistant starch, the polyphenols that we need to feed and fuel our microbiome. Variety is like diversifying your portfolio from nature.
Right. It's a good way of putting it.
It creates balance. It de-risks things. It provides all the different nutrients that you need, a variety of different nutrients. There are over 8,000 polyphenols. We know almost nothing about them, and they're all found in plants. So I would make the argument, and again, this is not a vegan versus non-vegan argument. This is no matter what dietary pattern you follow, assuming that you consume at least some plant-based foods, I want you to focus on adding more variety to your plate. And if you do this, you're going to see improvements in the way that you feel and your health in 2025. And then if I were to add 2 more, I'll just want to retouch on 2 topics that I think are really important that we touched on during this episode, but just to kind of pound these into the mind, I really think that outdoor time in the morning is important. I'm a huge fan of 30 minutes of a nice brisk walk outside, no glasses on, get natural sunlight. I actually wear a ruck vest when I do this, so it creates an exercise for me.
Nice.
I love it.
Yeah.
And you will, to the listeners, I'm challenging you to try this. because you will feel the difference literally on day one.
Yeah.
In terms of your energy, in terms of your ability to have cognitive endurance, in terms of your mood, and your sleep that night will be better. You will feel it on day one. And the last thing that I want to add, I really do sincerely believe that we have an epidemic of loneliness. I think it's brought on by our digital use. We spend 6 to 7 hours a day on a device.
Yeah.
We're not connecting to one another. So I'm challenging people to spend more time in real human connection in 2025. And that means eye contact and sitting down for a conversation and turning off your devices. A good place to start is mealtimes with all the devices turned off. That's a good place to start.
Beautiful. Beautiful. Well, I couldn't agree more with you. I really hope we get to meet in person sometime and we can properly have a sit down, eye to eye conversation. But this has been an incredibly enjoyable chat. You're an amazing scientific communicator. The way you talk about things is so amazing. I love the way you talk about the pathways, the mechanisms. It's so eloquently put. It's so optimistic. But it's so useful for people listening. It's so jam-packed with practical takeaways. So you're a big inspiration to me as a scientific communicator, and I just appreciate you so much chatting to me for over 2 hours.
That's such a high honor. I really appreciate it, Evan. And next time you're in the States, definitely let me know. We'll have to connect and hang out. And for people who are interested, I have mentioned my books. So my books are Fiber Fueled and the
I'll
Fiber
link
Fueled
everything
Cookbook.
below. Everyone should absolutely check out the book.
And my supplement company is called 38 Terra, and I'm very proud of what we're doing there. Please feel free to go check it out. We're actually coming to the UK and EU in the next couple of weeks. We're really close.
Okay.
So we'll be crossing over the pond and leaving. Right now we're in the US and Australia, but we'll be coming to the UK and the EU really soon. And then the last thing, like a free resource. I have a community of over 200,000 people on my email list, and it's my absolutely favorite thing. I work really, really hard. Like I spend hours per week preparing my emails, but I love it because it's an opportunity for me to like have meaningful conversations without any restrictions. There's no algorithm. You're not being like, restricted in whether or not you see my post or don't see my post. You will receive the email and you have the choice on whether or not you want to read what's in there.
Right.
But what we have is we have a very engaged community that's really enjoying this, and it's a free resource, and I want people to take advantage of that.
Absolutely. I'll link everything down below. Again, thank you so much. I couldn't be more grateful. This has been such a fun conversation. I learned so much, and I'm sure the listeners did. Thank you so much, Will. And best of luck in 2025 with all your work. I'm looking forward to your next book, your next chat, your next podcast, whatever you have up and coming. I'm sure that it's going to be great.
I appreciate it, Evan. Thank you, everyone. Thanks for hanging out with us.
Thanks so much.